This is my wonderful husband, Ryan, and we have 3 children. My oldest is 16, and the twin boys are also crazy at 12. And so you're always worried about having coverage in case something happens. You don't want it to happen. And so we have really looked at all different avenues.
Yeah, in fact, over time, we've used different forms of insurance. We've gone from private insurance with the major providers, tremendous monthly costs, tremendously high deductibles that created a financial impact to our family that was unsustainable long term. Then the risk of we went for a period of time with no insurance. You kind of roll the dice and hope and pray nothing bad happens to your family, but long term that's not a good decision for any family. And then there's the alternative providers, the sharing organizations, and there are some great ones out there. And we obviously are members of Impact Health Sharing.
What I really liked too is when we enrolled, everything was so transparent. What you got as your quote was what you paid. You know, you didn't have any mystery to it. And then with the guidelines, it tells you right up front all the things they're going to share, which is fantastic. Everybody in our group has the same goals: live healthy, support each other, protect each other's welfare, in a sense that we feel comfortable. We know we're going to have it covered, but we don't have to justify or pay for things that we don't agree with in our standards. And I love that because everyone's included. In some of the other groups, we weren't invited because of our religious background. And yet in this, it's love thy neighbor, and we have this group of hardworking, some entrepreneurs, some self-employed, gig workers, and we all want the same thing. But I'll be honest, my favorite thing is the telemedicine, because 3 boys, you need to call them for sure.
Well, and it's comprehensive healthcare, just not catastrophic healthcare. And one of the main things I appreciate about Impact Health Sharing versus some of the other sharing network organizations we've been part of before, they're preventative in nature. They're not reactive. A lot of the other companies don't share into any preventative healthcare. And it kind of shocked me as to why would you not want to be proactive in providing healthcare that's going to prevent major illnesses in the future, rather than being reactive and only care once you have a major health issue that could have been found earlier if you just shared into regular preventative health care. And so when I saw that about Impact Health Sharing, the fact that the billing was handled, it was treated like insurance, although obviously it is not insurance. It's an alternative to it, but it works better, feels better, and operates what you would feel is normal health coverage through your employer maybe, just from a different perspective.